Well, hi, I'm Dale Terasaki. I'm an addiction medicine doctor at Denver Health. I'm really excited about the potential of psychedelics to help with things like substance use disorder, which is my specialty. I recently wrote a commentary in a journal describing one of the concerns I have about Ibogaine for opioid use disorder, as many people are promoting it. I recently had a patient who came into the hospital and needed treatment for opioid use disorder. However, he was very hesitant to try some of the medicines we already have that we know work for opioid use disorder for most people. They save a lot of lives. However, he had a lot of bias against these medicines, and instead he was much more interested in talking about Ibogaine or pursuing some treatment like that. Unfortunately, later on, he never got to a therapeutic regimen of the medicine, and he largely did not want to be treated by that medicine. And so, unfortunately, he passed away. So what I want to avoid is patients being over-enthusiastic about some new medicines that are untested right now for opioid use disorder, and being biased against the medicines we already have that work so well at saving lives. Well, to be clear, a lot of the fault lies on the medical system because we don't know how to talk about this, and we don't know all the information about medicines for opioid use disorder. Sometimes we say the wrong things or mislead patients, but hopefully more of the medical system is learning that medicines for opioid use disorder like buprenorphine or methadone are life-saving. They are some of the most effective medicines we have in all of medicine at reducing death. And so that's my main concern, is that if we have a new medicine, a new strategy, a new type of therapy like psychedelics, including Ibogaine, it may distract from our efforts to promote these other medicines that we know work, that have been tested, and that have saved a lot of lives already.